please welcome Drew and Aaron. They are both social workers and colleagues at the Community Mental Health Association in Clinton, Eaton, and Ingham counties. They're going to share how they became, working in this field and how their paths took some interesting and unexpected turns, which is great because as we shared before, it's not always a straight cut path for folks, from, second grade, I decided that I want to be this all the way to becoming that career. So welcome, Drew and Aaron. I'll turn it over to you to speak a little bit. And then if we have some time at the end, I would be happy to lead a QA.
Okay. Before we start with introductions, if you're okay with this, we will take questions throughout it too. We have our own prepared questions, but if we're good with questions throughout, I think that Aaron and I are prepared and ready to go as we go throughout our presentation. So I'm Drew Kersjes. I'm the director for services for folks with intellectual and developmental disabilities at Community Mental Health of Clinton, Eaton, and Ingham County in the Lansing area. I'll dive further into my history, but I'll let Aaron introduce himself of who he is.
Hello, everyone. My name is Aaron Bakken. I am the supervisor over the residential department here at Community Mental Health for Clinton, Eaton, and Ingham counties.
Yeah, to give a little bit about our organization, we are pretty large for a community mental health. So we have about 1,100 employees within the Tri-County region, which is Clinton, Eaton, and Ingham counties. And one of the things that I was thinking about as I saw the behavioral health career day and applied to be a speaker was, what would I want to know as I was going into the field and how that has kind of taken twists and turns. So Aaron, do you mind sharing just what brought you into the field? How long have you been with community mental health? And we'll start there.
Absolutely. So I've been with community mental health, 19 years. A colleague of ours often says the days are long, but the years are short. It seems like just a blink of an eye. I started here. And what brought me to the field is that when I was in my early 20s going through school, I was struggling to decide, what career path speaks to me. Where are my passions? Because I felt as if I had interests in all sorts of different things, but nothing was really pulling me in. So I, inquired, and I heard from a lot of people in the field that, hey, give a community mental health, CEI, CMH is what they called it, a shot, as, the work is really fulfilling, and the culture that is built within the work is something that I think will really suit you. And so I was still working on my bachelor's at the time, and I ended up working in the residential homes, supporting folks with developmental disabilities. And it was just that. It was such incredible, meaningful work. The people we support being the focus of everything we did, but also building incredible bonds with colleagues that I now still hold 19 years later. I started off working in the homes. I ended up, after a few years, managing a number of sites. From there, I was promoted to being a district coordinator. And now, as of about a year and a half ago, I supervise the department. And so that journey is tied to exciting work, complicated work, but incredible meaning in the work and purpose that has kept me here this whole time.
Yeah, and I'm going to answer the question that I asked as well. So I started straight out of high school going into the field of behavioral health. And that about 3 years later took me to community mental health. So Aaron was here just before me. We have worked pretty much every day together since that point in time. And I also started as working in homes, direct care work with folks with intellectual and developmental disabilities. And was promoted to being a home manager. And then throughout my process, and this may be where folks are at who are on the live stream, I didn't really know what I wanted. I knew that I wanted to work with people, but I didn't know what the array of things that I could do with people. And so as I was finishing up my bachelor's degree, I was working alongside with folks in the home. Got my bachelor's degree in long ago, it feels like now, and decided that I wanted to do home management. That's what the position is in our organization, but really overseeing the daily operations of the homes of that we support. And then I was talked into getting a master's degree, and at that point in time, I graduated with my master's degree in 2018. What I found really helpful, and why I came into community mental health was the culture of person-centered support. And through that process, really, I learned a lot about myself, how to grow, how to challenge myself, to be better for those that we support. And that really aligned through every part of my education, in my time getting my master's degree. I think I'll leave it there. The next question I had, Aaron, and if there are any questions about what we have gone into, why we stay, what you're thinking about going into, please feel free to add that in the chat. But then my next question, Aaron, is what keeps you connected to the work that you do now?
Absolutely. I think whether, because all of the different opportunities that we have within behavioral health, within social work, so many different roles, so many different job opportunities, that what I have found keeps me coming back is the purpose within the role, where I can imagine a number of people on this call have heard a lot about self-care, have heard a lot, or is experiencing sometimes the grind and the challenge of doing person-centered work like this within behavioral health. And for me, what keeps me back is finding purpose in the work. And one of the common phrases that we say within our department is that when we are not aligned in the purpose of our work and putting the people we support first, work starts to feel like work. Self-care being such an important part about what we do, when we're really aligned to something that fulfills us, it stops feeling like work, and it's enjoyable and it's fun and it gets us through the hard days. As Drew had mentioned, we have been working together for many years, and that's working together through the COVID pandemic, different threats to the public health system, and every unique challenge you can imagine over the sun. And in the moment, those days were very, very difficult, very challenging days. But when we're tied to meaningful work, we look back at them fondly, and it's a situation where I couldn't imagine doing anything different. So that work isn't always easy, but because it's meaningful in a way a lot of jobs aren't, at least in my past experience, you build real relationships. You help the people you support live fuller lives. As Drew had mentioned before, you grow a lot yourself along the way. And if we stay grounded there, the people we support, it becomes way more than just a job, where your bonds with your colleagues become, your great friends, as close as family members. So it's all based in people-centered support and those relationships you build along the way that keeps me coming back.
Yeah, Aaron and I teach a class for all direct care professionals that come through our organization. And one of the things that I think keeps me coming back is that class. People coming in from another job opportunity or another career. And the comment that I think that we get a lot is looking for purpose and people finding their purpose in the work that we do. Our organization is very large, as I mentioned. There are many opportunities within our organization. But I think the one thing that stays consistent is finding the purpose in the work that we do. There are some very hard days, but I think the rewarding days outnumber the hard days. When you take a balcony view, look at that. What keeps me coming back is the folks that I support. Folks that I supported 15, 16, 17 years ago. And the growth that I've seen with folks, the growth that they've seen in me, in that point, and from that point in time on. And I think that what keeps me attached is the title of this presentation. I think it is more than a job. In that class, we talk about the work that we do not being a hat that we put on, but it is about who we are. Which in my experience, in my education, I think, Aaron, you probably agree with this, was really a challenge to embody that this is not about what we do, but really who we are and how we operate through that, which I think aligns very closely with the Social Work Board of Ethics. And again, that doesn't mean that there's not self-care, but it does mean that it is about who we are, how we operate, and how we walk in to the work that we have with integrity. Aaron, my next question is, unless there are, I can't see the chat, or at least I don't know how to see the chat. My next question is, when you were in high school, what do you wish an adult would have asked you regarding what you now know is your career?
I felt like in high school, Drew, that I had to have a pathway laid. I felt like, gosh, even into my early 20s, I had to already be certain I'm going to get my bachelor's, I'm going to get my master's, I'm going to practice this, I'm going to go into this line of work. And I think because of the pressure that put on my thought process, we sometimes say paralysis by analysis. I was, kind of stuck until the work found me. So if I was going to circle back around to a younger version of myself, I would probably say, don't be hesitant to get involved. A pathway doesn't have to look perfect for you to step into it. And whether it is the perfect role or the perfect area of expertise, there will still be a ton to learn from that experience. I think if I look back on the last 19 years within behavioral health, I look at the successes that we've had, but I look at a lot of the failures. Goodness, it's really, in a lot of instances, those failures and those struggles that help me then to define what that path looked like for me. And because the need is so great, I can imagine everywhere in Michigan, in the Midwest, and maybe globally, the need is so great for behavioral health that I probably, as a younger person, would have been involved earlier. I've now worked in the residential department here alone for the majority of my career, but I've also allowed myself to be embedded in a lot of other systems, in clinical systems and case management systems, policy formation systems, program development systems. And every single one of those opportunities had provided me something, a learning, a growth that I didn't picture previously. So yeah, I would just, again, tie it to all the opportunities out there to just be involved. And whether it's the perfect opportunity or not, there's still a lot of precious learning to take place.
Yeah, as you were talking, I was thinking about strategic planning. And one of the methods that is used in strategic planning is a analysis of strengths, weaknesses, opportunities, and threats. And I saw you hit each of those in that quadrant as you were just thinking about what does that look like. I would say that my experience has been the same. I thought I was going to be a home manager for the rest of my career. I think one of the things that keeps me here is that I think that many of the folks that I have worked with have seen more in me than maybe I saw in myself at that point in time. That's been my experience in the field, in challenging me further than what I think my potential is. And then stepping into that potential, open-eyed, ready to learn, and, with humbleness, being able to understand what growth does each of those situations bring to a learning opportunity for me. I think that to answer that question that I asked you, Aaron, I think that there is a pressure, the paralysis by analysis, like there is a pressure to have everything figured out. I think one of the things in my journey that I think speaks closely with your journey is I didn't know what I was going to be doing, but I knew that if I poured everything in that I had to give to the work that we were doing, those opportunities came. And to be honest, I wasn't planning on getting a master's degree, and through this process, ended up getting a master's degree, which allows me to do things that I never thought I'd be doing. That's been an appreciation I have had through this process. Next question. What's one of the biggest curveballs where you look back, 5-10 years, where you're like, I was not expecting that to happen? Like what throughout your career has been that thing where it's like it feels like an opportunity, but you don't really know, and you still jumped in being able to navigate what's next for your career?
Gosh, what a fun question. I feel like my journey in behavioral health is really curveball after curveball. And I do have a specific example in mind that I'll get to in a moment. But initially, stepping into this career, I was unsure if I was fit or cut out for so many curveballs and having to adjust. But truthfully, it's built such a wonderful skill set around meeting people where they're at, not having or needing a perfect roadmap to step into something. That one of the byproducts of these curveballs is development of such a great skill set to help people, not just professionally, but personally as well, navigate different things. I think it makes me a better husband. I think it makes me a better parent, and definitely makes me a better colleague. But to answer your question specifically, the biggest curveball, and again, I, at this point, role previously held by Drew, is the residential supervisor. So we oversee a massive network of AFC homes, both licensed AFC homes and supported independent living homes within the Tri-County area. We have a 20-home directly operated system. We also oversee and work with a much larger home of dozens and dozens and dozens of homes in the Tri-County area. And stepping into roughly March 15th of 2020, and the COVID pandemic was one of the biggest curveballs we ever navigated, where we had such uncertainty, no roadmap, and just a whole lot of fear in our staff, in guardians, and ourselves, and most importantly, in the people we supported. And coming together as a group where I had, our master's level clinicians stitching face masks for people, and we had dietitians stepping in and helping with food purchasing, and actually our own Drew Kersjes just leading us through all of that uncertainty. And though that was probably the biggest curveball, trying to navigate a collective living settings within such a scary pandemic where we had such little answers, it still provided me, I think, some of the best learning and growing of our lives. And whether it's a pandemic or whether it's a client stepping in your door telling you something that you haven't thought of or pictured before, everybody on this call, you are either have developed or are in the process of developing a wonderful skill set to lead through things like that. But that would probably be the biggest curveball that I remember.
Yeah, I would definitely agree that was definitely the biggest curveball. Also, probably, 5 years out of that or 3 years out of that, probably the greatest opportunity to grow with colleagues across. During that process, my answer would be, I was meeting with a lot of health departments in our Tri-County area, a lot of hospitals. And one of the things that I realized during that point in time is that a lot of the work that is done goes unseen. It's just, you and I pass probably 3 group homes on the way in within the Lansing area, and you wouldn't even know if you didn't work in the field that was an AFC, or that there was a clinic there for folks that we support, not just focusing on the residential piece, but there's a lot of work that is being done, and being able to explain that to our community throughout that process, I think, was the greatest learning opportunity I have. That there are places to partner. There are places for us to be able to connect with other professionals. And, our view is that mental health is just as important as physical health. And I think that our local health departments at that point in time we had an opportunity to be able to work with them and carry that view forward. That was definitely a physical health pandemic, but it was also a mental health pandemic at that point in time with the stuff that was going on and worries that people had. And I think the partnerships was the greatest lesson that I learned during that process. Okay, both of us have kids, and one of our other co-presenters who is out of the state right now. So today, I had this question written down for her. What is the greatest lesson that you have had that you would want your kids to know as they're coming into the workforce and graduating high school? Because both of you have a graduate coming up. And what does that look like for the next generation of social workers, behavioral healthcare professionals? What do you think, just as you're thinking about your child or your child's classmates, what do you think it's important for them to know?
Wow, this is a great question. I'm right in the thick of it, Drew, trying to provide some of these experiences and understandings to my 17, 12-year-old and 8-year-old, where I think a massive amount of learning takes place within the relationships and the culture piece that we were talking about when we first got on this call. I just know I'm so tied historically to understanding something before I step into it, having the right answer before the question is asked. I think my journey within this field has helped me and in turn helped not just me trying to help my kiddos, but also a lot of young employees that I supervise and mentor, is that having an appropriate heart posture for complicated situations can make or break the outcome. So for instance, stepping into that, whether it's a COVID pandemic or whether it's, a client walking in your door with a problem that you've not heard before, having a heart posture of service and connection can provide a platform for that person or that team or that child or yourself to feel safe in a way where then that person can then tie themselves to the answer that we're all looking for, or at least the pathway, where it's really a culture that you can create amongst your colleagues, your friends, your families, or your community that can allow us to hear each other better, allow us to assume best intent in our interactions, and again, allow us a platform to build. I see often, helping my 17-year-old in particular navigate relationships that he has with his teachers or with his friends, to be sort of that, to take a phrase from you, Drew, that lighthouse in the rough waters, to make the people around you feel safe, to be able to then build on something to help connect better, to help understand each other better and help communicate better. Because I do believe that's something missing, especially with young people today, at least in terms of what my kids bring to me, is that feeling of safety to be able to connect, communicate, and build. So not only is that something that I would tell my kids, that is something that I tell my kids, and we try to build for each other, and then we try to provide for the people around us.
Yeah, to answer that question, I think one of the things that I've already said is, mental health is just as important as physical health. And sometimes that can be very complicated with a lot of patience and understanding. And we say this a lot in our field, which is, let's meet the person where they're at. I think that learning how to do that in a way that isn't just about what we say, but what we do, makes a huge difference. I think that makes you a better friend. I think that makes you a better parent. I think that makes you a better spouse. And I think that those are the things that are important as I'm talking to high school, early college folks at this point in time. So it looks like we have about 7 minutes. Aaron, do you have any questions that have been prompted through this discussion that you would want to ask?
Goodness, I wish I could ask questions to everyone on the call to hear some of the things that they're experiencing, some things that they're navigating, things that are going well, things they're concerned about. Because again, and I'm really just repeating things that I've learned from Drew. Drew's been my supervisor for many, many years. Is that I'd love to carve out space for young people to be able to talk through some of the things that maybe they're concerned about, they're uncertain about, and try to provide that safe place to navigate some of those decisions. You know, some of the reasons why we're all in this field. So I don't really have anything other than that. It's just been an absolute privilege to be a part of this and a part of this conversation. So I don't have anything myself, but I'd love to field any questions or explore anything you guys want.
Yeah, absolutely. I'll jump in here. I don't see anything in the chat as of the moment, but I do have a question myself that you've both kind of touched on it a little bit, and it's something that our previous presenters haven't really talked about. So you've talked about kind of the curveballs and handling like things like COVID that come up that are really intense and can be very challenging. And as you talk about being the lighthouse in those rough waters for other people, obviously that takes quite a toll on yourself as a professional. What are some of the ways that you help to mitigate those responses and to take care of your own mental health? You know, we want to encourage students to enter into these professions, but we don't want to do that with rose-colored glasses. There are some challenges that come with helping people who are seeking out help in very dark places. So, you know, you talked about community. Is there other things, you know, personal experiences, resources, or even characteristics that have helped you kind of maintain your own health?
Yeah. So to self-disclose, I also have type 1 diabetes. And so that's a health challenge that I have. I think that as I think about that question, I think it is motivation that I get from my colleagues, from my family. Aaron in the pandemic started a weight loss challenge. I think between the two of us, we lost about 75 pounds during that process. So to make those things fun instead of it's with no judgment. So I think that that's important. Some of the things that I think that I do, and then I'll let Aaron jump in. I think physical activity is a huge thing. Involvement in the community is a huge thing for me. I would say I'm a people person, so that those things feed me. If that's not your thing, don't just do that to do that. And then find people who at your work align in the values of your workplace, and that work doesn't become like all it is more than just a job. See the people that you work with more than just somebody who does the thing, but as people. And so I think that would be my answer. Aaron, I'll let you jump in.
Absolutely. Wow, what a great question. This self-care is going to look different for all of us. So I'm going to speak to my experience, echoing, of course, a lot of what Drew said, because I was alongside of him through a lot of those things. In particular, though, what we talk a lot about in our department and in our teams is how we specifically rely on each other. And so, as Drew said, finding people within your department or within whatever organizational structure you have that share those values, but people, frankly, that make you feel safe, because there's a balance there. There's never going to be a time, as far as I can understand it, where there will be less work. The need is only increasing. The caseloads are getting larger. And frankly, your role within all of that is going to become just more and more important. And so we have developed, I think, trust within our team, where we support each other at such a level where we don't dread coming to work. We're eager to come to work because we're surrounded by people that want the best for us, that value the things that we value, being the people we support, and that we can really lean on each other when things are difficult, both personally and professionally. I can't imagine to do this work around people that I don't consider very, very close to me, people that I trust. And we can't control that, I know. But it is important that you find yourself amongst folks that want to support you as well. Because maybe I can't take a day off today or tomorrow because I have so many important things to navigate. but darn it, I can have a supervisor, I can find a colleague, I can have somebody who I can sit down with and vent to and process with, where those really unique challenges that are so difficult for us turn into strengths, turn into growth, because we work our way through them, as opposed to, fear them and perhaps even try to avoid them at times when it feels too much. So going back to kind of, I think what I originally said when I jumped on here is, when we align with purpose, the work doesn't feel like work. The work feels fulfilling and enjoyable, especially when you can find a culture that really wants to support you too.
And I did not pay him to say that, because I supervise him. So yeah.
No, that's perfect. Thank you both for sharing that. And I think it's just a very interesting perspective coming. We've had some, school focused, and most of the students on the call may only know social workers from that school-based profession. So just in that clinical work, there might be a argument to say, like, I would prefer that school-based because I get summers off, like caseloads. So it's great to really hear that there is that tight-knit community that makes, the clinical aspect of community work, there's positives to it too. You may not get a summer off, but there's lots of other things to look forward to.
I would just add that both Aaron and I work in 24/7 programs, so it feels like no days off. But just to add to that, Alicia, is because we work alongside each other, we lead from within. It's somebody who has an understanding of when to tap in, when to tap out, when do you need to help a colleague so that they can get that day off. We were challenged with that about taking like kids' birthdays off during the pandemic, right? That's not, we don't struggle with that now. It is more of a normal workflow, whatever normal is for your organization. I would say it's normal for us, but it is people who work alongside you, see you, the work that you're doing, and recognize, maybe you don't recognize that you need to be tapped out, but I'm going to tag in for you. And so I think that that's the culture that we want to build in the work that we do. That's been my experience in the organization that we work in. And I've fallen in love with it. I want summers off too. I thought that I wanted to be a teacher. I started at community mental health, and that was one of the curveballs. I fell in absolute love, and I couldn't imagine doing anything else.
That's great. I can't think of a better way to end the presentation. I personally wrote down a lot of like really nice one-liners that I think you just excelled at explaining and giving, just those perfect pieces of quotes that will help people to explore careers and make decisions. So thank you both so much for coming on today and sharing your experiences.